about to listen to the Dr. Dahlia Show. Sassy, stimulating medical talk radio. Any medical advice Dr. Dahlia Wax gives on her show should not be substituted for an actual visit to your medical provider. And now, here's Dr. Dahlia.
We are back on the Dr. Dahlia Show. Thank you all for tuning in. 1-877-Dr. 1-877-DOC-DALI. So one thing I have missed from airports is when you have to help a family member or you have a young child that's traveling or, if you don't have a ticket, you don't get to go to the gate. So remember before September 11th, you could be standing there at the gate welcoming people as they came out off the plane. And then you could be there and you could hug them and then you could help them with their carry-on or help them with their cane or you could push their wheelchair. Well, after September 11th, and understandably so, they really wanted to limit who was getting onto the plane. And everybody had to have a ticket, even though the 9/11 terrorists all had tickets and they got on the planes and sadly did what they did. Horribly did what they did, but they needed to limit the amount of people going through the TSA screenings, and I get that. I really, really get that. But the one thing I have noticed in the last 20-some years at airports is when you have somebody that needs help, they sit there and they wait for, a wonderful, really, beautiful, blessed airport worker to help them. But if they're short-staffed, if airports are short-staffed on somebody who could help them with the wheelchair, etc., that person sits and they sit and they wait. And, I have a mom who will sometimes fly to see my brother and I can't go with her to the gate. You have to drop her off, get it, and somebody could say, well, when they're like that, they, like a child shouldn't travel alone, an older person shouldn't travel alone. People want to travel alone, but they just might need a little bit of help. They might want a little bit of help. And so I've been wondering when we're going to be able to make arrangements where if you want to help somebody travel, you could do so. Because I don't like the idea of, well, if I can't go by myself, I can't travel. No, if you want to go and see somebody or do what you need to do, you need to be able to do what you do. So interestingly, there are going to be some airports like Oakland, San Francisco Bay Airport that will introduce guest passes for non-flying passengers. Now, right now, you have to have a valid boarding pass, go through security. But other airports are going to start offering non-passenger passes. Other airports might also roll them out in the future. So Cleveland Hopkins International Airport has a hangout pass. San Antonio Airport has an SAT or SAT pass. And Kansas City International Airport has a guest pass. Other passes include a wingmate pass, such as Philly, or a destination pass at Detroit Metropolitan Airport. And so it's interesting because this is something where, if you need help or assistance or somebody to keep you company, I think it's fantastic. And then having somebody meet and greet you. So what's really interesting is, for me, I travel all the time. And yeah, you get off the plane, then you got to go to baggage claim. I live in Las Vegas, Nevada. So our McCarran Airport got changed to Harry Reid Airport. Not sure why they just don't call it Las Vegas Airport, but I get it because it serves, Henderson and Pahrump and all that. But they call it Harry Reid Airport. So if I ever forget to say Harry Reid, I say McCarran. Sorry, but the name changed a couple years back. But you have to take a tram, oftentimes, to get to the right terminal where your baggage is. There's Terminal 3, there's Terminal 1. So you want to make sure you're going on the right terminal to where your baggage will be. Then you want to go and get your bag. And then you need to carry your bag and go get your Uber or whatever. So what my husband will do whenever I fly alone is he'll meet me in the baggage claim because that's where you're allowed to do, which is fine because then he can help me lift my bag. But yeah, I have a bunch of crap in my bag. I always do. But, if somebody has to navigate all that alone, what they do is they go to they let security know that they need assistance and then they sit and wait for somebody to help. And then that person navigates through. And I think these airports are overwhelmed. And so, we don't want people just hanging out or trying to use the lounges. And usually the lounge is like, no, 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 you need a ticket. So I get that. But if somebody is there to help somebody and be there, I think that's good. So how I guess that would work is you would have to go through a screening process, I believe 7 days prior. So non-passengers will apply online for security clearance up to 7 days in advance of the day they want to visit the airport. After people fill out the form, the TSA will approve the visit by sending the non-passengers a guest pass. So that's how it works in Oakland Airport. So for those of you who have family members that are traveling and you're a little worried, or you have a child that has to go to his mom's or go to his dad's or whatever, you might be able to apply for this. So I would, and you know what I'm thinking? I'm thinking that this has been around actually probably for a while. And it's just they didn't want everybody and their mother applying for it. But I'm under the impression that if there's a minor or if there's somebody with a medical issue, you're able to get special permission. So my guess is this was a system in place. It wasn't built for tons of people. Now they might be a little bit more comfortable with that. So I would definitely get that checked out. More than 122 million people are expected to travel between December 20th and January 1st. So it is going to be pretty busy. In fact, I think even more because a lot of people are leaving today, being that it's Friday. This is a 2.2% jump from last year's record high of 119.7 million travelers. They think 8.03 million people are going to be flying over the U.S. holidays, which is a 2.3% jump. Florida, Southern California, and Hawaii are the top destinations for the holidays. I think Hawaii is beautiful, but for me, I still want to feel Christmas. I am going to be going to Hawaii for a medical conference that I have to go to, although I'm a little nervous because it's going to be pretty costly. Hawaii is getting really, really expensive. But for Christmas, apparently it's one of the busiest times for people to go. Beautiful weather, it's beautiful. You guys will love it, but expect things to be crowded, there to be delays. United Airlines says they are expecting December 27th to be one of their busiest, most crowded days. 1-877 Dolly. Don't go away. All right, we are back on the Dr. Daliah Show. Thank you all for tuning in. 1-877 Doc Dolly, 1-877 DOCDALI. Big thanks to Talk Media Network for making the show happen. Big thanks to Daniel, our producer, and big thanks to you all for tuning in. We really do appreciate it. Don't forget to follow us on Twitter or X at Dr. Daliah, Facebook, The Dr. Daliah Show, and on YouTube, click like and subscribe. So when I heard that there was fraud that had to do with billing and Medicare and in Minnesota, I was like, oh gosh, I hope they're looking everywhere. Because sadly, when one person figures out a way to screw the system and screw people over, I am sure there are other individuals that are going to copycat, if not already. And the U.S. Attorney's Office has announced a new batch of charges that are stemming from the fraudulent billing in Minnesota's government services. And this involves the Center for Medicare and Medicaid. And they pulled claims for 14 programs identified by Minnesota officials being particularly vulnerable to fraud. And they found $18 billion in Medicaid billing that could have been fraudulent since 2018. This is being reported by KSTP.com, ABC News 5. Now, they said while not all of those payments were illegitimate, Thompson estimated that half or more of the $18 billion, or over $9 billion, was received through fraudulent means. So prosecutors are now working through that and sifting through that to get exact numbers. I mean, $1,000 of fraud bothers me, let alone $1 million, let alone $1 billion, but over $9 billion? So what the hell is going on? According to Thompson, he said the magnitude of fraud in Minnesota cannot be overstated. It's staggering amounts of money that's been lost. Now, in October, Governor Tim Walz announced a third-party audit of those 14 high-risk programs, put a 90-day hold on payments to providers to review claims for potential fraud. One of those, housing stabilization services, was discontinued on October 31st. Multiple more defendants, I think another 6, have been charged who allegedly defrauded the HHS program. Another indictment against a provider in Minnesota's early intensive developmental and behavioral intervention program for autism also has been charged. Among those cases, according to KSTP, was what Thompson dubbed fraud tourism, in which 2 defendants, a 37-year-old Anthony Waddell Jefferson and 53-year-old Lester Brown, allegedly traveled to Minnesota from Philly to set up fake companies and exploited the HHS program to the tune of $3.5 million. They're each indicted on 1 count of wire fraud, chose to travel halfway across the country for their scheme. In the federal indictment, prosecutors outlined how a shared associate informed them and 2 other associates that she heard Minnesota's HHS program was a good opportunity to make money. Why? Well, no oversight, no checks and balances. When government money comes pouring in, now, I know people are really, really upset with what's going on with HHS cutting, some of the grants. I mean, grants get cut all the time, and we want to make sure that these aren't programs that are productive programs that really, really help kids. But it's not that uncommon when HHS is getting defrauded and money is being wasted and not going to where it needs to go to, reevaluate what the hell is going on. And so Brown and Jefferson is accused of registering LLCs in Minnesota. They visited shelters in Section 8, housing facilities known as the Housing Guys. They were accused of hiring family members and associates to work as employees, made fake clients, and then they enrolled patients, submitted forms, and to get payments. And this is just not, allegedly, not cool. Chosen Runner LLC and Arresto Real Estate LLC established in Pennsylvania. They're still active LLCs. And so, I mean, these are crimes from people from other states going, you know what? The money's in Minnesota. So what's happening? Well, how are they going to fix it? Excuse me. So one thing Minnesota said they were going to do, and I know a lot of people are thinking, wow, we have 800 doctors who have been doing fraud. No, what they're doing is they're disenrolling 800 Medicaid providers from the state Medicaid program that don't appear to be seeing Medicaid patients. They have not billed for services for more than a year. And this move would, quote, strengthen the integrity of Minnesota's Medicaid programs and services. Now, some of you are going, that's it. Now, I'm hoping this is one of multiple steps. But apparently, a lot of doctors, when they get credentialed, and this is a system that really has to change. So I'm about to graduate residency, and the nearby clinics are like, we need people now. Well, you can't see patients until an insurance company approves you. You get your licensing, you pass your boards, you graduate your residency, but you can't see patients until you go through another process that has to do with insurance companies. And some of these insurance companies have to credential you, and that could take 6 to 9 months. And so when a doctor finally does get credentialed through Medicare or Medicaid, if they're temporarily between jobs or whatever, they don't necessarily go and call them up saying, look, I'm in between jobs, because if you get kicked off the list, it takes you forever to get back on. So, and many of us were credentialed by the company we worked for, so we don't even know who to call. So there's a lot of doctors who, now I left Medicaid, I believe, because when they weren't paying us, and I said, look, guys, I have $50,000 worth of claims. What's going on here? I just didn't hear from them. But I don't know if I officially left them but I've worked for places and I've taught at universities, so they always credential you for Medicaid and Medicare, which is appropriate. But if you're not actively billing, you really don't want your name in the system, because somebody could bill under your name or fraudulently say they're you. Even though it's a pain in the ass to get back on them, I think it's a safer thing to do to not be then, consider that. However, One thing that is adding a little bit of some issues, and I think it was Minnesota, where during the Obama years, there were a lot of doctors saying, look, I'm not getting paid by Medicare or Medicaid. I'm being threatened to be audited. You know what? I'm not going to see these patients. We're not getting paid. I need to see the volume. We're not, we're at risk of getting audited. I'm just not going to see them. And I think Minnesota was one of them who suggested this, where, and I think New York might have been another state, saying, look, you don't get licensed and you don't get to keep your license if you don't take Medicare or Medicaid patients. Now, I don't know if that ever stuck, but I noticed, because I'm licensed in multiple states, they ask, do I see patients, who are underserved, et cetera? Well, I work for a telemedicine company, and yes, I do. So as long as the telemedicine company is giving me those patients, I'm seeing them, which is good, and I want to. But, when Obamacare hit, and a lot of doctors are like, I'm done, or I'm going to concierge medicine, and I'm going to just take cash, many older individuals said, I don't have a Medicare doctor. Where do I go? And so states were trying to figure out what to do to kind of force doctors to take Medicare. So there could be a lot of people that said, look, I want to make sure I still get my license and nobody messes with me. Keep me on the Medicare plan. But I'm, currently not working, or I'm retired. So that could be it too. So, removing the providers does eliminate a layer of fraud if somebody tries to pretend to be one of these providers. Is it enough? No, they need to do a hell of a lot more. And so, funding cuts and reevaluating what these people were trying to take the money for. And it's really a shame, because it's hurting the people it's supposed to help. If you have families that need food, and these Meal on Wheels or whatever company that, and it wasn't the Meals on Wheels company from what I understand, but something similar to that, is getting money from the government, there has to be more transparency. But if there's not enough auditors, and if there's nobody looking, these people are taking advantage. And poor individuals aren't even getting the food. It's people claiming that they went to this house, they went to this house. I mean, idiots. Absolute idiots. And so waste, fraud, and abuse is something that this administration promised that they're going to tackle. And it looks like they are. It's just, my guess is it is so big and there's just too much going on. People are frustrated going, well, why are they making, healthy adults with no kids go back to work to get their Medicaid or food stamps? Because that eliminates waste, fraud, and abuse. If you can work and you're able-bodied and you're strong and you don't have a kid to support and you don't have a medical condition, why aren't you working? Or volunteering or going back to school. So there's, we have a lot. We doled out a lot of money we told academia that we're going to let students borrow even more money so that academia raise their rates. With Obamacare, we told insurance companies we're going to subsidize you. If you have to raise your rates, and this is where we're at today, and it's frustrating. And so hearing that, possibly, they didn't have to investigate $18 billion in claims. I mean, that's just the tip of the iceberg. 1-877-Doc-Dolly, don't go away.
This is an urgent announcement for anyone that's $10,000 or more in debt. Before you make another minimum payment, you need to know there are special programs that can completely free you of your debt. Total Financial Freedom can help you become debt-free in months instead of years. Resolve your credit card debt, signature loans, department store cards, internet loans, and timeshares. Call Total Financial Freedom now at 800-878-6020 for a free consultation. For 16 years, Total Financial Freedom has helped thousands get out of debt. You can feel confident when calling because Total Financial Freedom is A+ rated by the Better Business Bureau. Battling for years and years, stuck in the endless cycle of minimum payments could take decades. You have the right to get your debt resolved and substantially reduce your monthly payments. Call Total Financial Freedom now at 800-878-6020. That's 800-878-6020. 800-878-6020.
Let's face it, guys, we're living in times where the truth is becoming more suppressed and censorship is increasing at an alarming rate, especially on social media platforms. It's Clyde, and I want to tell you about a safe and secure digital playground we put together just for you. It's Aftermath.media. You get access to thousands of Ground Zero archives and podcasts, along with our private social media groups with your basic membership starting at only $7 a month. Each subscription includes tech support, access to the RSS feeds, along with our own chat room and Telegram channel. In addition, the premium membership includes research study groups, webinars, a document and movie library, a live video stream of Ground Zero, a monthly Zoom chat with me, and other bonus content. Be sure to check out our yearly specials as well. Sign up today while you're thinking about it. Sign up at Aftermath.media. Again, that's Aftermath.media.
Dr. Dahlia here. Are you tired, burned out, gaining weight, succumbing to the daily pressures of life? Well, how's your dopamine doing? How you feel right now, how you'll feel an hour from now, and how you'll feel next week is completely reliant on your dopamine. Our daily motivation and willingness to push through challenges depends on the intricate chemical process dopamine provides. Christian Kalikas and I created Deploying Dopamine, a book that tells you what dopamine is, when it dysfunctions, and how to successfully deploy it when needed. Find Deploying Dopamine on Amazon today. Check it out.
Lisa Wolf here to tell you about our newest website for old-time radio lovers. It's 100radioshows.com. At this site, there are 5 old-time radio shows waiting for you to download free as our gift to you. And be sure to browse the additional 700 old-time radio shows available to you for 70% off by using the promo code RADIO at checkout. This is a limited-time offer, so log on to 100radioshows.com. That's 100radioshows.com.
We are back on the Dr. Dahlia Show. Thank you all for tuning in. 1-877-DOC-DALI, 1-877-DOC-DALI. Big thanks to Talk Media Network for making the show happen. Big thanks to Daniel, our producer. And big thanks to y'all for tuning in. We really do appreciate it. Don't forget to follow us on Twitter or X at Dr. Dahlia, Facebook, The Dr. Dahlia Show, and on YouTube, click like and subscribe. So while we're still in absolute shock that Rob Reiner and his wife Michelle were brutally murdered, throat slashed, multiple stab wounds over the weekend, we were even more shocked to hear that their son was the primary suspect. And we're learning more and more about Nick Reiner's mental health issues. And we're being told that he was suffering with worsening schizophrenia, had become, quote, erratic and dangerous when doctors changed his psychiatric medications a week before the alleged murder. Sources told TMZ and being reported by Daily Mail that the accused killer was seeing a psychiatrist for his spiraling mental illness, and that his behavior had become alarming in recent times. He had been attending a Los Angeles rehab facility that specializes in substance abuse that charges about $70,000 a month. In the weeks before the murders, doctors reportedly changed Nick's medication, the alleged murders. Doctors reportedly changed Nick's medication, which made him more erratic. And one source said he was, quote, out of his head. Now, from what we understand, his parents were concerned, wanted to keep an eye on him, so they took him with them when they went to a Christmas party at Conan O'Brien's house. And there was a lot of bigwigs and, big Hollywood party. And people who were there said that he displayed antisocial behavior, started staring at attendees, getting into loud arguments with his dad, and I believe Bill Hader, asking everybody, are you famous? What's your name? And people were kind of getting concerned. And then he was asked to leave. And, rejection, that always brews, anger. But, he was already acting erratic. And I think people were concerned, about their safety. And Romy, his sister, 28 years old, discovered their parents' bodies. And she's the one that told investigators that her brother allegedly should be a suspect, because he was, quote unquote, dangerous. And, with schizophrenia, it's frightening. When you have somebody who suffers from schizophrenia, the majority of people are just angels. So sweet, so, lovable, but you do have some where if they do mix alcohol abuse or if they do not get control of some of their behavior, there's a very, very small percentage who could become dangerous. And I guess he was living in his parents' guest house in Los Angeles over the past 5 years, so his family could keep an eye on him. And he had actually destroyed the house before. And he would do meth, not sleep for days, then have outbursts, break things, punch walls. And a friend said he was a ticking time bomb. His drug use was getting worse, and his parents wanted him out. His parents knew that something was up, and it's a shame. It's really, really a shame because, it's just so tragic. So schizophrenia, to review, it's a very serious mental health condition. Every one of my patients who I had was just absolutely sweet. They did require a lot of support, a lot of help. Their psychiatrist would have frequent visits with them to manage their medications. And I never thought they would hurt a flea. That just absolutely, but unfortunately people with schizophrenia, if it's not in control, they could have hallucinations. They could have delusions. They could have disorganized thinking. They could see things, hear voices, be told to do something that could be bad. No matter how lovable somebody is, they might think that person is evil and out to get them. So there could be delusions. And many individuals with schizophrenia might not understand that they have a mental health condition. They might think that is the proper reality, and everybody else is off and not believing them. And so you have individuals who look at everybody else as, oh my gosh, I'm surrounded by people who are crazy. They don't get me. They're not seeing what I'm seeing. They're not hearing what I'm hearing. How do I live among all these people that aren't seeing or hearing? There's something wrong with them. And that's where things could get very, very concerning. So symptoms could be the delusions, hallucinations, disorganized speech and thinking, very disorganized, unusual, motor behavior that might not be typical in a social setting. There's also negative symptoms where rather than acting out, they might isolate, they might not bathe and not make eye contact, not show emotions. And so we usually diagnose schizophrenia by adolescence. You don't necessarily, these individuals don't necessarily get picked up as kids. They get found or diagnosed usually in late teens, early 30s. Schizophrenia can happen in men and women, but in men, we might see it in their late teens to early 20s, and women, we might see it when they're a little older. And, the symptoms could be kind of hard to pinpoint because, according to Mayo Clinic, a lot of teenagers may not do well in school, have trouble sleeping, withdraw from friends and families. A lot of teenagers do that. And so, on their own, like, I'm just going to stay in my room. I don't feel like going to school. I don't feel like going to class. How do you know they're being a typical teenager or they're having schizophrenia? So, if you do suspect that your child might be struggling, whether it's anxiety, depression, drug use, you want to get them checked out. Now, a question I keep getting asked is, if law enforcement want to profile, individuals and try to find the next, person who could be a killer, why aren't they looking more at individuals with mental health diagnoses? Because as I've said before, the majority of people with schizophrenia are not violent. Now, one study done by the NIH said that of all the homicides, 6 to 10%, they believe, were committed by individuals with schizophrenia. That number rises with substance abuse, lack of treatment, history of violence. But they do believe that people with schizophrenia are only responsible for 6.5% of all homicides. And then 93+%, is from something else. So no, if you want to minimize the next murder or the next, or you want to prevent that, you're going to have to look beyond just that, one diagnosis. There's multiple other issues that could be at play. However, it is extremely important for doctors and family members to realize that there could be danger, there could be abuse, there could be acting out. And it's so hard because you want to help this person and you want to be there for that person, but that person might not want to be helped. They might not understand you. They might not listen to you. They might hate you for the wrong reasons, have delusions about you. They might think you're holding a knife when you're not. And so it's frightening. And so I don't know. I can't even begin to think what was in Nick Reiner's head for him to want to go into his parents' room and murder them in their sleep. I don't know. Allegedly. I don't know what could have, happened and what could have, I mean, it's, but the one thing that I think we're all learning is, you look at these families, whether they're Hollywood, whether they're, middle income, whether they're low income, and everybody has their, everyone tries to pretend like their lives are perfect and all that. And there's a lot of backstory and there's a lot of things going on. And I could just imagine the Reiner family must have really, really struggled having somebody who possibly could lash out, act out, be violent. And then now with the loss of the parents, Romy and her brother, I forget her brother's name, unfortunately now, are orphans and now their brother is being tried for murder. It's frustrating. And what also makes things really, really difficult is, we have medications and we have rehab facilities. And look, he was at a $70,000 a month rehab facility. I mean, we have resources, especially for the rich, and it didn't work. Now, they can work if somebody has the support and somebody is able to stay on the medications and work. But, people say, well, the doctor changed his medicines. Well, why did he change his medicines? Were the medicines not working? Did he tell the doctor he was going to kill himself or he wanted to kill somebody? So the doctor said, I have to change the medicines. If a doctor changes the medications, most probably it's because the original medicines weren't working. But a medicine change can be sometimes a very, very dangerous time. So, we'll keep you posted as we see more and more of this unfold. But it's just heartbreaking. 1-877 Doc Dolly. Don't go away. Dr. Dahlia Show. Thank you all for tuning in. 1-877 Doc Dolly, 1-877 DOCDALI. So the calls to repeal and replace Obamacare for years never have gone through. Republicans couldn't do it the way the bill was written. And so one other option that was brought up by, I don't want to say Republicans or Democrats, I just heard from Americans, well, if you defund it, doesn't it then just fall apart? And then we could start from scratch. And I didn't necessarily want to see that because I think the way it's built, the system implodes. And you have to, we're going to have to replace it with something. But I have been really, really bothered with the fact that rather than the money going to patients, it goes to insurance companies. And then premiums go up. And then the insurance company says, I need this much more money. So the patient doesn't have to pay this. And the government's like, well, here's more money. And the prices are ridiculous. People feel like they can't use their insurance. The deductibles are too high. They can't find a doctor. And the health system kind of stinks. Well, when Trump was asked, if he has a Trump care or a broader health care overall, he says there was no need to repeal the Affordable Care Act because Americans are going to just stop using it. He says, as far as I'm concerned, according to NBC News, I rolled it out last night. That was when the Republicans had a health care bill, which they passed. The House passed a bill. Has to go to the Senate, but everybody's gone for Christmas now. I guess they left today. I thought they were going to work today, but I guess they're gone. They're not working today. But the Republican plan was, subsidies, HRAs. Let's kind of take this away from employers who don't even really want to manage the health insurance. And if they fire you, you're stuck. Why not we also have other groups that could join together and be able to get insurance costs cheaper? Employer insurance is much cheaper for a person, but it doesn't help them if they lose their job. So what about Costco and Sam's Club? Or what about, let's say a part of a gym? What if we allow other associations to group together to be able to enter a marketplace or be able to negotiate prices? So I thought, what the Republicans came up with wasn't bad. I would have, preferred to just see the subsidies cover for a month or two just something so we don't have this cliff on January 1. But maybe that's the Band-Aid being ripped off. I don't know. And so when Trump says there's no need to repeal it, he says, I don't have to do anything because Obamacare would just repeal itself automatically because nobody's going to want to use it. It's too expensive. Now, 24 million Americans get their insurance through the ACA and get subsidies. Now, the U.S. government increased the subsidies during the COVID-19 pandemic, but that increase expires December 31st unless Congress acts. Well, the increased subsidies, why don't they go back to the original? Why are we still doing COVID era increased in subsidies? Because people ask, why aren't the Republicans or the Democrats a little bit more on the same page with this? Well, it's because these are COVID era. You see, the media never tells you what exactly the nooks and crannies are. We allowed insurances to get more government money because we were in a state of emergency with COVID. Well, that state of emergency should have sunsetted, and they did. The subsidies did sunset. All right, the COVID era rise in premiums ends 5 years after COVID. However, now people are used to that, and they're like, well, now insurance companies are going to charge me an arm and a leg. Insurance companies should never be charging you an arm and a leg, but they are. So House Republicans came up with a plan. Republicans in the Senate came up with a plan, but the Democrats are 3 years extension or nothing. Well, that's going to be a problem. So then, I'm looking at this as it's going to be a mess. January 1, looks like they went on break. But I wonder if this is a strategy. If people see that this isn't sustainable and immediately the House and the Senate can pass something where people can now get insurance through Costco or Sam's Club, rather than if their employer isn't paying for their insurance, because these are non-employer subsidized plans. These are for people going to the marketplace on their own. And if they're able to get insurance in another way, and with the money that they have, they're not going to spend $10,000 plus a year, thousands of dollars a month, high deductibles. They're going to say, look, if you want me to buy your plan, it better be a better plan. It could bring down costs. Now, it's not going to be pretty. It could be pretty ugly. But if an insurance company is not going to be getting the gravy train, they're going to have to come up with a way to get these 24 million back. And if they want the customer, they're going to have to lower their rates. And so, it's interesting. As much as I do not want, people in the middle of this. I don't want people losing their insurance January 1. But the system is really kind of messed up. And how do you get an insurance company to lower the rates? How do you get academia to lower tuition? And boy, are they getting gobs and gobs of money. Well, how do you get them to lower tuition? You say, you know what? You're not going to get the student loan amount you thought you were once going to get. We're not going to be giving $500,000 to a medical student. Okay? A medical student should not be charged $500,000. $200,000, but no, you're not going to get the $500,000. No. Well, you're going to start to see the rates go down. And so I'm not saying this is a good idea, but I'm wondering if that's the strategy. If it's a crappy system and we have to keep throwing COVID numbers, enhancements at something that people still aren't happy with. Doctors lost their job or they had to close their practice. They're working for corporations. People can't get into a doctor till months from now. It's a mess. The medical system is so bad. And a big part of it is, you're reliant on your boss. And if you don't have a boss, now you have to try to pay for insurance on your own, and you can't. We have to have a marketplace where you can buy insurance on your own. We also have to have non-$1,000 a month medicines. Wegovy, Mounjaro, Zepbound, Ozempic. Luckily, Trump has worked with these companies to get the prices down. Well, if they get the prices down, now the insurance company can't say, well, we're paying for $1,000 meds. All right, well, now if that $1,000 med went down to $250, you could start lowering your rates. So it's an issue. This is not something that's going to be easy to fix. But rather than kicking the can down the road, we're going into year 17 with Obamacare. And it's a mess and it doesn't work. And I'm wondering if the not passing the subsidies might finally fix it. I'm not recommending that, but I'm wondering if that's their strategy. The problem is they have, midterms coming up. And so is this going to be a good move or a bad move? You've had, people on all sides saying we need something better than Obamacare. If they could come up with something better than Obamacare, this could be huge. But if they don't, and people can't get insurance cheaply, or their rates are going to be too ridiculous, and the insurance company won't lower it, that could be a mess, especially for 24 million Americans. But how it stands, and I'm not saying I'm a fan of this, but this might be their strategy where, look, January 1 comes along, insurance is going to say you need to pay us $8,000 a month. The patient will be like, oh, hell no, that's not happening. I don't have $8,000 a month. So then the insurance company will say, well, then fine, we're not going to insure you, which is going to be scary that they won't have insurance. But then on the other end, these insurance companies now are losing that. They might say, you know what, we're going to offer you another plan. Now, usually, though, you got to get on the plan, sooner or later, or there's only an enrollment period. But insurance companies are going to maybe have to change your tune. So I don't know. I would have extended the subsidies for at least a month or two just to give them to be some wiggle room. Or I would have not left for Christmas. I would have said, all right, guys, let's just get this done. But this is where we're at. 1-877 Doc Dolly.
Carl Amari here to tell you about our newest website for old-time radio lovers. It's 100radioshows.com. At this site, there are 5 old-time radio shows waiting for you to download free as our gift to you, and be sure to browse the additional 700 old-time radio shows available to you for 70% off by using the promo code RADIO at checkout. This is a limited-time offer, so log on to 100radioshows.com. That's 100radioshows.com.
Have you ever thought you'd like to buy and sell houses but didn't know how or where to get the money? My name is Ron LeGrand, and over the past 40 years, I've bought over 3,000 houses without using my money or credit, and taught thousands to do the same. Today, even in a virtual environment, we buy nice houses in nice neighborhoods using no banks, realtors, contractors, or other costly entanglements, and build huge cash flow and wealth without the hassle of tenants, all without credit and little or no money. You don't need a license or experience, and I'll show you exactly how it's done. Text FREE to 99-799, and I'll send you my free training. I promise you I'll change the way you think about real estate and open the door to a new lifestyle that doesn't involve risk or rehabs and can quickly replace your current income. Text FREE to 99-799, and let me show you how to take your life back and build cash flow and wealth from your home. That's FREE to 99-799. Again, FREE to 99-799.
Hey guys, it's Dr. Dahlia. Fantasy football season is coming, but sadly, too many of you are taking the bench while the country takes part in one of the most exciting and lucrative industries out there. Don't know how to play? Well, huddle up and listen. Paul Kalikas and I have written a fantasy football pocket guide for beginners. This book walks you through the basics and shows you how simple and lucrative joining or creating a fantasy football team can be. Read our fantasy football pocket guide for beginners found on Amazon, or follow the links on X and Facebook. That's Fantasy Football Pocket Guides for Beginners. Don't be left out.
Can you believe, with all the recent violent protests, looting, and destruction, some areas are considering either defunding or abolishing the police? At a time when America's neighborhoods need the protection of police the most, some elected officials would rather create more chaos by playing politics. If you're sick of elected officials caving in to demands of the radical left, you're not alone. It's time we stand up and declare our support for local police. The majority of police officers are important partners in protecting our God-given rights. If you prefer freedom over chaos, then learn how you can help protect the local police that serve your community. Call today and request your free Support Your Local Police info packet. Dial 800-JBS-USA-1. That's 800-JBS-USA-1. Request your free Support Your Local Police info packet by calling 800 JBS USA 1 today.